Welcome to the Phoenix Domus Emergency and Safety Training, where you will learn about the importance of being prepared for emergencies and safety issues specific to our facility. This training is designed to provide you with some detailed information as it relates to overall safety and emergencies that you may encounter as an employee at this facility. During this training, we will look at the importance of emergency and safety training as it applies to the facility. We will look at fire safety procedures, including looking at the fire alarm system. We will also look at what Phoenix Domus does to make sure that our facility is as secure as possible. We will be looking at the overall fire system that is important and an integral part of our emergency and safety system. We will conclude by looking at what staff should look for when determining when to call 911 in emergency situations. The steps to fully complete this training are as follows. 1. Take the training pretest. 2. Watch the training video. 3. Review the emergency and safety policy and procedure. 4. Take the post-test following the training. Screenshot for documentation. 5. Print out all documentation, send it to the Employee Development Officer, and ask for a certificate. The Employee Development Officer will be able to provide the training certificate following completion of all these pieces mentioned here. In addition to being mandatory as per various oversight entity requirements, this training is very important as it pertains to the overall safety and wellness of our residents and staff. The aims of this training are that it will minimize the risk of accidents and injuries. It will also prepare staff and residents to respond effectively to emergencies. It allows us to equip staff to handle emergencies calmly and efficiently, ensuring the safety and well-being of all those in the facility. This training also aims to reduce liability and legal risks for the facility, as we strive to prevent property damage and loss. There are 3 main focus areas related to our emergency and safety training. The first is the actual training itself, which allows the staff to prepare for emergency situations, potentially saving lives of our residents and staff. Emergency training also includes CPR and first aid training for all staff members and equipping the facility with necessary first aid supplies. Another focus area of our emergency and safety protocol is related to security of the facility. We will review that on the next slide. Finally, another major focus area of our emergency and safety protocol is related to fire safety and procedures, which will be covered in detail in this training. Our security protocols include thorough screening of potential residents to assess their needs, risks, and compatibility with our facility. This includes looking at criminal history, substance abuse history, mental health issues, and any indicators of violence potential. We also attempt to secure the facility as much as possible. It is very difficult to try to ensure that the facility remains locked all the time, as we have residents constantly coming and going in and out of the facility. However, we do have secure entryways with surveillance cameras. We also have proper lighting to deter unauthorized access to ensure the safety of those in the facility. We also emphasize the importance of employing staff who can de-escalate conflicts, handle emergencies, and provide support as needed. We also place emphasis on educating residents on personal safety and risk avoidance to foster a respectful and secure environment. The third focus area of our emergency and safety protocol is fire safety procedures. This includes things like fire safety education, where we educate the staff and residents on fire prevention and safety measures to reduce risk of fire and ensure preparedness. We also hold mandated monthly fire drills at various times of the day. We conduct these monthly fire drills to practice evacuation procedures and ensure everyone knows how to respond quickly in case of a fire. We have a certified fire alarm system. It is imperative that all employees understand the fire alarm panel and the manual pull fire alarms, including where they are located and how to use them in case of an emergency. Our facility also has 4 certified fire extinguishers, and we place emphasis on staff knowing how and when to use them properly. Next, we'll take a look around the facility, paying close attention to emergency exits and where they are located. We'll also look at the fire alarm system in detail, review how to conduct a monthly fire drill, and look at the locations of the fire extinguishers. We will also take a look at some more detailed security and safety measures that the facility employs. We'll end with a discussion of when it is appropriate to call 911 in emergency situations. Our facility has a total of 5 emergency exits. The upper level has 3 emergency exits, as depicted in the pictures here. One of the emergency exits is located in the upper level kitchen area that should be used for quick evacuation of residents and staff. The upper level common area has 2 emergency exits. One is located at the rear of the facility in the common area. The other exit is located in the front of the building, right off of the common area near the washer and dryer. In any emergency evacuation situation, any of these 3 emergency exits may be used, depending on the emergency situation and the closest direct line to get outside to safety. The lower level of the facility has 2 emergency exits. One is located on the lower level front entrance of the building. Typically, if 911 is called, this is an exit to be used for any residents located on the lower level. There is also a lower level side door which offers an additional evacuation path and is a primary entrance and exit for all residents to use. We are now going to take a look at the fire alarm and response system. To begin, the fire alarm panel, which is shown in the picture, is located in the boiler room on the lower level of the facility. This panel controls the fire alarm system for the entire facility. There are manual pull fire alarms, which we will go over on the next slide. There are horn strobes on each level that will flash bright white lights and emit a piercing beeping sound when the alarm is triggered. This is the case whether the alarm is set off automatically when it detects heat or smoke, or when an employee or resident has to pull the manual fire alarm. In all cases, all residents and staff must evacuate the building and gather at the designated spot when the horn strobe activates. This holds true for any issues with the alarm going off from somebody cooking, etc. Next, we are going to take a look at the manual pull fire alarms. There are 2 of these located in the facility. One is on the upper level in the main common area adjacent to the rear door. The other is located in the lower level in the main common area. These manual pull fire alarms would only be used in case of an emergency, where you would recognize smoke or fire and the alarm system did not go off automatically. In the event that you would have to manually trigger an alarm, you would then proceed with evacuating residents out of the facility. Follow the other proper protocol procedure for when to notify management and when to call 911. This slide shows a picture of the horn strobe that is located on the upper level of the facility. Each level has several horn strobes that are electrically tied to the electronic smoke detectors and fire alarm system. For this training, please take a walk around the facility and note where all of the flashing horn strobes are located. Our license requires us to have monthly fire drills. These fire drills are to help us prepare for an emergency fire situation. They help us to make sure that our system is working properly, and they help us to document any issues or concerns that may arise during the drill. There are several steps to take when completing the monthly fire drill. The fire drills may happen at any time during the day or night. However, we are required to hold 2 overnight drills between the hours of 12 o'clock a.m. and 5:30 a.m. every year. The steps to complete the fire drill process are: first, have the fire drill log ready to fill out after the drill. Next, alert one on-duty staff to assist, but do not inform the residents or other staff beforehand. The goal is to mimic a real fire scenario, where there wouldn't be forewarning or any other preparation prior to the fire. The next step is to start the drill. This is when you would go to the boiler room and locate the fire panel. Start your timer. Press the signal and silence drill button located on the fire alarm box. This will trigger the alarm. If there are 2 staff on duty, alert the staff on the upper level to begin to evacuate. When evacuating facility, start at the back of the facility and work your way toward the exits that you will use for the drill. It's recommended that the exits used for the fire drill are the rear of the building, as the gathering place for the drill and real fire situations is in the upper parking lot behind the dumpster. Once you believe all residents are out, have staff sweep the facility, checking for any residents that may be in the rooms, bathrooms, laundry facilities, etc. Once you get everyone out of the building and to the designated spot, take a head count and document how long it took for the drill to take place. Once you have determined that the facility is empty and you've documented the time to take to get out of the facility to the designated spot, you may send a staff member in back to the fire drill panel and select the signal silence and drill button again to turn the alarm system off. The final step would be to complete the fire drill log and review with the project director. The facility has 4 certified and inspected fire extinguishers. The locations of the fire extinguishers are depicted in the images on this slide. As an overview, there are 2 fire extinguishers on the upper level. One is located in the upper level kitchen area. This extinguisher is easily accessible for kitchen-related fire emergencies. The other fire extinguisher on the upper level is located near the front entrance of the facility to the left of the door. There are 2 fire extinguishers on the lower level. One is in the kitchen area of the facility to address any fire hazards that may arise in this area of the facility. There is also a fire extinguisher on the lower level in the common area. This extinguisher provides safety for residents and staff in shared spaces. As fire extinguisher use is key to stopping initial fires, all staff are required to be trained annually on the use of fire extinguishers. It is very important to know during emergency situations, when to call 911. This slide shows scenarios when it is appropriate to call 911. In any case, resident and staff safety are priority. When there is a threat to life, 911 should be called immediately. The following situations require 911 to be called in any health emergency: heart attack symptoms, such as chest pain, shortness of breath; stroke symptoms, such as facial drooping, arm weakness, slurred speech; unconsciousness, severe bleeding, difficulty breathing, choking, seizures; apparent overdose; serious injury, such as head trauma, broken bones, and any attempted suicide or suicidal ideation with imminent threat or intent. Other emergency situations that warrant calling 911 are if there is a fire, violence, or threat of violence, intrusion into the facility by someone not known, any suspicious activity, someone out of control posing danger to himself or others. It is very important when 911 needs to be called that the proper channels be notified accordingly: patient communication and contacting the nurse care coordinator. Accurate record keeping of these incidents and actions taken for accountability and follow-up are crucial to ensuring that our emergency and safety measures are effective and carried out quickly. Finally, policy drives much of what we do in the emergency and safety issues. It's very important to be aware of the emergency policy and procedures in order to ensure proper steps are taken during emergencies. One final component to this training, which is essential to fire policies and procedures protocol, is ensuring that smoking only happens in designated smoking areas. Our facility has only one designated smoking area that is located on the lower level patio. Smoking signs are placed to designate this area as a smoking area. Smoking in non-designated smoking areas, such as the back deck, the sidewalk out front, the sidewalk on the side, company vehicles, personal vehicles on company property, etc. Residents who disregard this policy must understand that there are consequences, up to and including discharge from the program for recurring offenses. Cigarette butts should be disposed of in the receptacles that are set up for this purpose only. This slide recaps some of the additional security and safety measures that Phoenix Domus puts in place to ensure the safety of the residents, staff, and visitors. To sum up, the safety and security measures help ensure the residents and staff remain safe. The process begins with a thorough screening of the residents. We also attempt to secure the facility as best as possible, with cameras located to capture all entryways to the facility, as well as other pertinent places in the facility where issues could arise. We also place an emphasis on training staff on issues related to safety and emergency, have regular discussions at monthly staff meetings, and ensure that we have staff trained in CPR and first aid. In addition, we set clear rules and expectations that are used to establish protocol and proper ways to handle situations as they arise. We attempt to operate an atmosphere that promotes and fosters a culture of respect, dignity, and support among all staff and residents. And finally, to aid in the security and safety measures of the facility, we maintain a strictly enforced policy related to drug and alcohol use and conduct regular drug testing to support this component of our safety and security measures. Now that you have finished viewing the training, here are the next steps. Make sure to read the emergency and safety policy and procedure. Take the emergency safety training post-test. Fill out a training evaluation form. Screenshot your post-test score and send to the Employee Development Officer. Give the Employee Development Officer your training evaluation form and ask the EDO for a training certificate.